is so important. And to even leave from your comfort zone to take care of Phebe is something that we encouraging everyone to do. Instead of us just say the government will not do all, but we the citizens that come to the hospital, it's good to just give back to these kind of places. We remember it's not for us, but the patients that will come through these places will be able to remember you. So we want to say on behalf of the county rep team, we want to say thank you. This will not be the last. Please, you can also look ahead or wherever that you need for us that we can collaborate and see a bigger picture. We are open of doing that. Maybe those of you who are listening via radio or social media, Bong County, like I said, government will not be able to do everything. The hospital have contributed towards the life of a lot of people in this region. Both Guinea and people came from Guinea and Sierra Leone to have access to this hospital. And government needs are so many, they will have money spending all over the place. But if you were able to bring a chair to the hospital, if you come to the hospital and just see the need that are able to do this, now you will be remembered for that. So I want to say thank you. You can reach that thank you to your colleagues that are back. I want to say thank you and thank you to you can have all these ideas and people who on ground and they don't try to translate that into or implement that for it will be another setback. So the project coordinator and even the management of the hospital, I want to say thank you for at least living by the project cycle and seeing the need that we can be able to help our people. Thank you so kindly.
Okay, thank you. Being an MC and I'm going to break protocol. We're going to the next item that's a ribbon cutting ceremony, and the bowl we have his remark as we enter in there. So the cutting of the ribbon will be the bowl chair CHOLNA/USA.
So I'll just make a quick statement and then Phebe Hospital, I'm the president of the board of Phebe Hospital trustees. This hospital, I have my own bosses. The governor of Liberia, the Lutheran Church of Liberia, the Episcopal Church, the Methodist Church, the Catholic Church, and our partners, the Evangelical Lutheran Church in America. We constitute the board. So I'm very glad this morning to come to this program, and I want to extend a heartfelt thanks and appreciation to you for this meaningful contribution that you have made. I will convey these messages to members of the board and to our partners. A hospital, one thing about a hospital is that you don't know when you're going to come in. I was just telling you exactly, last month or so, my brother was here. My wife has been here. I have been at this hospital. My son was born here. So you never know when you come to the hospital. So I will cut the ribbon on behalf of the children of Bong who may come, whose mothers may come to deliver in this hospital. I will cut the ribbon on behalf of the babies that were born in this hospital. I'll cut the ribbon on behalf of the mothers that came here yesterday, last night, to give birth. And I cut the ribbon in name and honor of all the partners, the citizens of Bong County, Liberians at large, even to you all. So we join the place. So we'll cut this ribbon in the name of the Father, the Son, and the Holy Spirit.
then when the woman becomes ready, fully, or she's ready to give birth, she has to walk from across here to the delivery room. Yes. And you have people sitting all here because they come to see the doctor. And most of our mothers, because of the thing, you will not want to wear clothes and other stuff. Yes. So that was behind that I said, let's transfer the labor ward this way. We didn't have to remove that from his office because usually the space was just like 3 beds. So we removed that from his office. This way we brush, we walk, we increase the size. Every day now, instead of 6, we have 9 beds. So when they get, please don't go behind the curtain. So when the woman gets ready to deliver, she just walk across there to the delivery room. Yes, you walk across there to the delivery room. Sure, nobody there. Okay, so just watch me. So if I'm the one in labor, when I'm ready to give birth, instead of walking across the hall, I walk this way and just go straight.
And we make wheelchair available for them to transport them.
That's the easiest walk to help her. So this is a new postpartum walk. And another reason for a little delay in the project, we were still serving the public while renovating. So we had to move the patients from here to a pretty part of the piece more, while we're trying to get this place set up. That's the reason. So we're going to get them back here and try to set up everything, but everything has been the county on the board.